Welcome to Off the Clock, the webcast of employment attorneys at Miller Johnson, where we discuss what is happening in the HR world and provide practical insight and advice.
Hi everyone, I'm Rebecca Strauss with Miller Johnson. Welcome to Off the Clock. Today is a special episode. I've traveled up to our Grand Rapids office to visit with one of my friends and colleagues who is not Sarah Willey. I miss Sarah Willey a lot, but luckily we have lots of other folks here at Miller Johnson who are really good at what they do in different specialized areas. So I'm excited to be here today with my friend and partner, Tripp VanderWal, who's a benefits lawyer. Hi, Tripp.
Hi, Rebecca.
As you know, as just before this recording started, I know absolutely nothing about benefits, right? That was painful, and you may have to point that out a few times during this session. I'm much more of an employment lawyer, right? And a lot of clients don't realize this, but employee benefits and employment law are really quite different, right?
Correct. I think we have a lot of overlapping where we work together a lot, but I think the issues are very, very distinct and different with what you encounter versus what I encounter on a day-to-day basis.
So what I love about having you and your team at Miller Johnson is when I run across a benefits issue, I can just call you.
Absolutely.
So there's been a few topics that do touch on benefits that clients will call their employment lawyers about because they may not even realize it is a benefits question, and that's really what I'd love to focus on today, right? The areas of benefits law that impact our HR folks, even those that are not responsible for benefits at their organizations, based on what they're struggling with right now. And what is every organization struggling with right now?
Attracting talent.
Attracting talent and COVID.
Correct, yes.
Right?
Which I think is somewhat intermixed, right? Overlapping.
They are intermixed, absolutely. And those are the two hot issues for HR right now. So let's start with attracting talent, because that seems to be causing our clients quite a bit of stress, right? And organizations are looking for creative ways to attract talent, or maybe when they actually have a great candidate in the door, but that candidate needs a certain something maybe with their benefits, right, to make our client's offer more attractive. And then our client says, can I do that, right? Even though that's not the benefit package we offer to all of our other employees. So why don't we just start there? I kind of walked ourselves into the first topic. It's always nice when that happens. So let me just give you a sample question and let me know what you would have to say about it. Okay, and this is, of course, not using the right benefits language, because as we know, I don't know anything about benefits, but here we go. All right, client is hiring for a hard-to-fill position, very specialized technical position, maybe, right? And they have a candidate who's interested. But the candidate to take the job says, I need certain parts of your benefit plan altered and in a better way, right, than what you offer everyone else because of my specific family situation or health issues or whatever it is. So when I get that question, Tripp, I call you, right? And I say, can the client do that? Can they have 1 off, 2 off, 3 off health and welfare provisions?
From a very, very high level, the answer is yes, or at least potentially. Or, as they say in law school, yes, but it depends, right?
That's why people hate lawyers.
Yes, right. So there's a lot of other considerations that have to go into that, and they're going to be dependent on what you're trying to achieve, right? Are we trying to achieve a kind of a unique benefit package for one specific employee, a group of employees, or whatnot? But in my issue, I mean, what this raises when I want to have and I'm limiting my conversation right now to the health and welfare benefits. Retirement, we'll set that on the side. Maybe you can have one of my more retirement partners on in a future episode. But if we're going to want to vary in how we offer health and welfare benefits to some employees versus to other employees, kind of the initial issue that comes up is non-discrimination issues. And in my world, that means very much different from what it means in your world, okay?
Right, because when I hear non-discrimination, I think protected characteristics and conduct.
Exactly, and that's not what it means in my world at all. So,
really?
As you're likely aware, there's tax advantages that come with offering benefits, right? So oftentimes employees can pay for their share of benefits on a pre-tax basis through a Section 125 cafeteria plan.
Okay.
And of course, when you go get services from at a hospital or a doctor's office, you're not taxed on the value of those services, right?
I never thought about it.
Exactly. You're not, the answer to that question is you're not.
Okay, good.
Fortunately.
I'm glad you're here to tell me that.
And because of those tax advantages, the Internal Revenue Code is designed to make sure that those tax advantages are not just extended to the C-suite people or the executives, but that we are making the same type of offerings available to the general population of employees. And so what discrimination means in my world is, are we discriminating in favor of highly compensated employees or highly compensated individuals? And actually, those are similar terms, they are actually terms of art that have different definitions. And not to belabor this, but when you're allowing employees to pay for their share of benefits on a pre-tax basis through a Section 125 plan, we generally have to make sure that the offering of benefits is not discriminatory in favor of highly compensated employees, which is generally any employee who's making at least $130,000 a year.
So if I were to call you with that question, I've got a client who wants to offer a certain applicant better. Can I just say better? That's probably not.
Exactly. More generous, any term.
More generous,
Yes.
more generous health and welfare benefits. Your first question to me may be, what is the compensation for that employee?
Correct.
And if it's a lower compensation, if it's, $60,000, let's say, are you less concerned?
Potentially. From a Section 125-ish perspective, I am, because they're not considered to be a highly compensated employee unless, for example, they happen to be an officer or some type of owner. But they're what we call a non-high, and so generally the IRS, the Internal Revenue Code, yes, they're a non-highly compensated employee. That's the lingo, a non-high that we, because these are long terms here. So generally the Internal Revenue Code allows us to discriminate in favor of them. Okay. So, but that's not the end of the story.
So affirmative action for non-highs.
Yes, exactly.
Is that actually a phrase you use? Or
that is not until today. It is. Maybe it is now.
Okay.
There's another layer. If you have a self-funded plan, whether that be a medical prescription drug plan, dental plan, vision plan, those are kind of the limitations where we see self-funded benefits. We also have to worry about those are subject to kind of a similar but different set of non-discrimination rules. Fully insured plans, at least right now, are not. Okay. But that prohibits discrimination in favor of highly compensated individuals, not employees, highly compensated individuals. And this is actually a little bit more of a tricky issue because a highly compensated individual is basically any employee who's in your top 25% of employees ranked by pay.
Okay.
So if you think about it, I often have this question, I've worked with some nonprofits that, even the executive director may make, $50,000, $60,000 a year, and they're,
Sure.
If they're large enough to have a self-funded plan, they say, we don't have any highly compensated employees or individuals. Yes. And I say, well, actually, by this definition, 25% of your workforce is highly compensated.
Yes.
And so again, if they're going to fall in either one of those, it's not the end of the story, but we have to maybe look at other angles. To give you an example of how sometimes this works, there's a lot of organizations that have large self-funded plans, but they have what they call executive health plan arrangements, right? Mm-hmm. And the executives are in fact eligible for a much more better or generous benefit, as you put. And the way that, for example, they do that is they fully insure the benefit for the executives. So we avoid those non-discrimination rules that apply to self-funded benefits. Okay. And then we tell the executive, it almost seems too good to be true, but it works out this way. We actually tell the executives, you're not allowed to even contribute towards the cost of your benefits. Because if they're not paying on a pre-tax basis under a Section 125 plan, arguably the Section 125 non-discrimination rules don't apply. So basically they can get a fully insured benefit for no cost to them, and that kind of avoids all the non-discrimination rules. So there's ways that we can take kind of those arrangements, maybe maneuver them a little bit and get to where you want to go. Now, sometimes if we're talking about just a single employee, right, it becomes harder, where if we want maybe a group of employees. Now, if we can't do it on the health and welfare benefit side, there are other ways that we can throw we can simply pay them more. That's one option.
Yeah.
But there's other ways that benefits can be useful. That some of my partners who are do more retirement or executive comp, we could do executive compensation arrangements if they're going to be more on a C-suite or an executive level person where they're going to earn a greater benefit. Even outside of the retirement plan that may not vest for a certain period of time. There's, income tax advantages to that where they don't necessarily have to pay tax right away. So there, outside of even the health and welfare world, there are, potentially opportunities to look in, the retirement executive comp space as well.
So if I'm, as a non-benefits lawyer, if I'm understanding this correctly, if our clients are put in that position where someone wants different or better health and welfare benefits than what's part of the general package, they should call us, let us know the employee's salary or proposed salary, the salaries generally of all their folks, because we need to figure out who's in the top 25%. And then we check in with you.
Yep.
And see what's acceptable and what is not.
It's probably even better to bring me in the fourfold, like right at the beginning to kind of discuss where they want to go, and then we can kind of figure out what information. Because gathering census information, especially if you do it organizational wide, may not be the easiest thing to do. So before we maybe want to go down that rabbit hole, let's figure out where we are, where we want to go.
That is very
because there can be other opportunities too. For example, maybe we give employees more an election rather than saying this is what you're eligible for in this classification. Here's kind of your election between whether you want greater wages or more benefits. Again, that's probably an election that needs to be run through a Section 125 cafeteria plan. So very easy to do with new employees, but if we're in kind of the middle of our Section 125 plan year, a little bit more difficult to do with current employees because we can't change our pre-tax elections mid-year except in the event that we've incurred certain events. There's also, cash in lieu provisions. So if I elect to waive my benefits, maybe my employer pays me additional compensation. This is, a feature that a lot of employers use right now. One thing to be mindful of is back in, I think, late 2015, the IRS issued some guidance that said, basically, if you are going to implement any new cash in lieu arrangement now, we're going to kind of grandfather the ones you have in. I think it was some weird date that the IRS notice came out, which was like December 16th, 2015. Don't quote me on that.
I'm going to quote you on that because that's my birthday.
Oh, wow.
Thank you, IRS.
So if you're subject to this pay or play penalty, this employer shared responsibility penalty, which is the requirement if you have more than 50 employees to offer your employees health insurance or potentially pay a penalty, you may need to add that cash in lieu value amount to the amount that employees are going to have to pay to elect employee-only coverage, which could cause your offer of coverage to be unaffordable and therefore open you up to penalties. So while cash in lieu arrangements or opt-out payments are potentially out, and there's ways to structure that to avoid those affordability issues.
Are there ways? Because I think that's actually very attractive, or should be. I bet, frankly, a lot of folks listening to this haven't even thought about it. But I think in this tight labor market where there's, as we all know, there's wage inflation and people keep competing against each other, right, for higher hourly wages, higher annual salaries, to be able to say you can have, a much higher salary if you don't want our benefits, that can really, get someone to jump up, for instance, when they're advertising on Indeed or whatever it is.
We can structure it as what they call an eligible opt-out arrangement, which basically avoids the affordability issue. But if you have a self-funded plan out there, one thing that I always like to tell my clients is cash in lieu provisions are adverse selection issues. And that is the people the young, healthy people that you most want on your plan, because they're contributing in but not really using, they're the ones that are most likely to waive coverage and take the additional compensation, right? Where if you get the older, sicker employees, they're like, no, that being enrolled in the health benefit plan is a much better, is much better to me than that additional hourly wage or that bump in wages.
Sure.
Because they're utilizing that plan. And so adverse selection is basically when you are destroying your risk pool, right? Because you're putting more utilizers in there. So
self-funded plans might want to be careful about that.
Correct. And even fully insured plans that are, in the large, what we call the large group market, which is generally for employers with more than 50 employees, while you're passing that risk on to the insurance company, employers will know they get, they're experience rated. So every year, the insurance company looks at what their experience was in the past year, and then that's how they set their premiums going forward for the next year. So if you have, a lot of heavy utilizers in your plan one year, you may end up getting a renewal quote for the next year and in a significantly higher amount than what you had expected or what you're used to.
So thinking that through for just a second, could an employer say the only way you'll be eligible for Inlieu payments, in other words, the only way we'll give you more money on the front end if you don't take our benefits, is if you're getting insurance through another plan, for instance, a spouse's plan?
So that's actually, it's funny that you say that, because that eligible opt-out arrangement that I mentioned to avoid this affordability issue, that's kind of the requirement. You can allow anybody to waive your coverage. You can only give the cash in lieu option to people who attest that they have other coverage that was obtained from a source other than the individual market. So either whether that be on the exchange or whether that be off the exchange, because they don't want to incentivize employers to basically put their high risk or high utilizer people into that individual market, which of course has high government subsidies through the form of premium tax credits and cost sharing reductions.
So as with any benefits issue, I'm left with the overall impression that it's more complicated than I thought before I asked you the question. But the feeling I'm getting is that there are strategies here that employers can use, benefit strategies to sweeten the pot, right, in terms of offers and that sort of thing to help attract talent to their organizations in a tight labor market.
Absolutely.
Right?
Absolutely.
Okay, but it's a little tricky.
It's a little tricky.
So
and it really depends on how you want to do it, right? Because if you want to go this way, this is the things we have to worry about. Where if we want to go one off, we're going to totally change it. That's a different issue than the cash in lieu issues.
Right. And in larger organizations, as we know, HR departments are often split between the benefits folks, right, and the recruiting or the hiring folks. So maybe this is an opportunity to collaborate.
Yep, absolutely.
Right? Maybe the folks on the front on the recruiting side can say, we'd have more success, right, if we could offer more options in terms of whether someone's even getting benefits or not. And then the benefits folks can work on the back end, right, with you, making sure it's done properly.
Yep.
Okay, that's awesome, because all of our clients are looking for ways to make their positions more attractive, right? And recruit. All right, so now let's get to the number one benefits question I've gotten over the last year. And of course it has to do with COVID, and it has to do with vaccines. We're not going to talk about the mandates, okay, unless you really want to.
Well, I'm going to mention the mandates, but you'll see why. So we don't have to get into the weeds on that, but I think this is going to be a driver of interest in where you're going, at least amongst employers.
All right, well, we'll see, because we can monitor when people tune in and tune out from the podcast. So we'll circle back around on that and see when people turned off the podcast. But stay with us, because here's the number one question, benefits related question I've been getting that's also COVID related. For organizations that want to encourage employees to get the vaccine, they've been looking at all kinds of options. These are folks that don't want to issue a mandate and don't have to by any law. And so the question I've been getting is, can we change the insurance I'm going to say rate and coverage, because these are actually two separate questions. One question I've gotten is, can we deny coverage to for COVID-related illness if the person is not vaccinated? And then the other question is, can we decide on different rates, right? Can a person who is vaccinated, in other words, pay less for their coverage as a carrot? So one's a stick and one's a carrot.
Yep. So you cannot deny benefits based on someone's vaccination status. So for example, if someone is unvaccinated and goes to the hospital because they've contracted COVID and need to be in the hospital for care, you can't say, we're not covering your care. That would violate HIPAA's non-discrimination issues.
Okay, so that's...
Or discrimination provisions,
That's remarkably black and white for a benefits question.
Correct. Yes, you're right.
That is the shortest answer, Tripp, I've ever gotten from you.
Enjoy it.
In the past 12 years that I've known you. That is the shortest answer. Okay, so clients should just not think about that.
Yep.
Okay, because I've actually gotten that question.
Yep, and I have too, but that is not a permissible approach. Okay. Now, what is permissible is your second one, and you did frame it as a carrot, but I think you can actually frame this as a carrot or a stick, and that would be basically varying what the employee has to pay, the employee's share of the premium, to enroll in benefits based on vaccination status. And the reason I think you can set it up as a carrot or a stick is you can either look at it as an incentive. You will pay a lower amount should you become vaccinated, Or you can look at it as a stick. You will pay a greater amount if you're unvaccinated. So to me, it's two different sides of the same coin, but it kind of starts like, okay, here's your starting point. Are we going to pay? Are the unvaccinated people going to pay more, or are the vaccinated people going to pay less? So it's a little bit carrot or stick, and generally that is permissible. But again, this was actually what creates what we call a HIPAA wellness program, and there are HIPAA wellness program rules that go around that.
One of our folks listening, for instance, goes back to their leaders and says, I have an idea of something we can do that might have an impact, right, on how many of our employees choose to get vaccinated. Are there certain high-level areas they need to be aware of? Like, if we decide to go down this road, then we have to be careful of X, Y, and Z.
So the first is how much of incentive or a surcharge that you can impose.
Okay.
And so generally it's limited to 30% of the total cost, and that would be the employer's portion and the employee's portion of the employee-only coverage rate.
Okay, so you lost me. I'm literally one of those lawyers that went to law school because there's no math on the entrance exam. Can you walk me through an example with real dollars?
So let's say we're dealing with a fully insured plan. So the premium charged by the insurance company to the organization, let's just say, is $1,000 a month for someone who wants to enroll in employee only or single coverage. They're not covering their spouse, not covering any kids, just themselves.
$1,000. ABC Corp is charged $1,000 by the insurance company.
And maybe the company splits that so they pay $800 a month and the employee pays $200 a month, right?
Okay, I'm with you.
Well, we're looking at the total cost. We're looking at the $1,000. We're not looking at what the $200 that the employee pays, or we're not looking at the $800. And we're saying the limitation on the incentive has to be 30% of that. So we couldn't have an incentive or surcharge that was more than $300 per month.
So then how much more expensive could we make the employees share if they don't get vaccinated?
So if, again, assuming that the employee pays $200, the employer's paying $800, we potentially can go up another $300 and make the employee pay $500 a month.
Now, that's more than I thought you were going to say.
So it's $200 plus the $300 difference, right? Now, a couple things to keep in mind. One, if you have already have a wellness plan in place that's subject to HIPAA, you're adding that you only get 130%. You don't get 30% per component, right? So if you already have a wellness program, which a lot of employers have, you're adding whatever the vaccination surcharge or incentive is on top of that. So that may further limit your amount.
Okay.
And to the extent that your wellness program has a health-related component like vaccination status, you actually, when you set affordability, again, for those people subject to the pay or play penalty, you have to set affordability assuming that everybody failed. So everybody was unvaccinated. So basically, going back to our example, you have to use the $500 a month in determining whether that offer of coverage is affordable, which it's probably not going to be, except for some very well compensated employees.
Okay.
So that's going to further limit you.
Okay.
Now, a couple other issues, I think, if you're interested in this, if you are going to administer the vaccination on your own, the employer is going to do it, or contract with a third party, not only are you worried about the HIPAA rules, we're potentially worried about ADA considerations, which has kind of their own set of wellness program rules. And unfortunately, what's a permissible incentive or surcharge under the ADA? Nobody knows anymore because we had regulations that were repealed after some litigation by ARP. And then
Did you just say nobody knows?
Yeah, it's up in the air. We had a bright line number in regulations back in 2016, but in 2018, due to litigation, those part of the regulations were repealed. The other thing is, and this is what because I got a lot of these vaccination surcharge questions last fall.
Yeah.
I think for a couple different reasons. One was people were going into their annual open enrollment because a lot of plan years run on a calendar year basis. Two, the announcement by our friends at Delta Airlines that they were going to do this. And so everybody thought, Delta's going to do it, can we do it?
I agree. My phone started ringing too after Delta.
They kind of died off because shortly thereafter, President Biden announced, the potential, that that OSHA was going to release this ETS, and that's where I wanted to just touch on this a minute. So everybody, I think, kind of a lot of my clients put their vaccination surcharge questions on hold and said, if we're going to have to mandate this, it probably doesn't make sense to have a surcharge or incentive to encourage it as well. So let's just wait. Well, fast forward, OSHA ETS is on hold right now. It's not dead, but it's not.
It's not alive either.
It's not. Yeah, it's not going to be. It's not coming into place like right away, like we thought.
Purgatory, the right term to use there.
I think employers are starting to recirculate and come back to, well, do we want to do one of these surcharges? And I think what's difficult is now we're in our plan year, right? And so Section 125 has a provision that basically says, if most Section 125 plans incorporate this provision, if there's a significant cost change in what the employee has to pay for coverage, if we offer other medical plan options, we have to allow them to switch medical plan options in the middle of the year. And if they don't offer any other medical plan options, we have to allow them to drop coverage. So let's say we're talking about a hypothetical employer that only offers one medical prescription drug option. Right. They put in this vaccine surcharge mid-year. The cost change is significant for some employees. We potentially have to let those employees drop out of coverage mid-year. And what's challenging about this is our friends at the IRS have given us no guidance on what is significant versus insignificant, because insignificant changes an employer can automatically change. And what's further frustrating is it probably is going to depend on an employee by employee basis, right? So if we're talking about like a flat vaccination surcharge of $50 a month,
right,
that may be insignificant for the executive type level employee,
right?
But that might be significant for someone way on the bottom of the pay scale.
A non-high.
A non-high.
A word I learned today.
Exactly.
Yes.
Exactly. So I think while you can implement these mid-year, I think if you're going to, as an employer, you need to go into this eyes wide open that administratively it can be burdensome, especially if you're talking about a very large employer with several thousands of employees. You may be fielding these requests. The one last thing I'll touch on, if you're going to do this, HIPAA requires there to be a reasonable alternative standard for people who basically can't get the vaccine for a medical reason. So we have to offer them another way to achieve the vaccinated rate.
Oh boy.
And we most compare these to smoking cessation programs. And what happens if I'm a tobacco user, my employer generally says, you got to sign up for a tobacco cessation course, and if you complete that course, you'll get the non-tobacco user rate.
Okay.
Frustratingly enough, you just have to complete the course. You don't have to quit using tobacco. So, how you frame that in the context of vaccines, I think is a little bit more difficult. I know a lot of employers are just saying, well, if you have a medical reason that you can't get the vaccine, we'll just treat you. We'll waive the standard, right? We'll just treat you as though you're vaccinated for purposes of attaining the vaccinated rate. That's permissible. Others may do some type of education. Maybe if they don't otherwise have a mask mandate, you have to wear a mask. Maybe there's a social distancing mandate. So you can have other ways to obtain that. But for medical purposes, if someone can't get the vaccine, you do have to have a reasonable alternative standard under HIPAA.
Most people listening are either in the middle of it or have PTSD as a result of looking at lots of exemption requests for vaccine requirements, okay? Because when folks were preparing for OSHA, as you know, a lot of them were dealing with either mandatory vaccine policies or vax or test, and we're dealing with lots of exemption requests. And this was for a federal contractor and CMS too. And under those rules, you could request an exemption for either medical or sincerely held religious belief. So I just want to make sure we're being crystal clear here on what you're talking about with different policy rates based on whether someone's vaccinated or not. If I heard you correctly, you have to allow the lower rate if someone can't get the vaccine for a medical reason. What about for a sincerely held religious belief?
Nothing under HIPAA requires you to give a reasonable alternative standard for religious reasons. But I think, and I've talked to people in our, your colleagues in the employment and labor group, whether Title VII applies here, and arguably it does, but I think where the consensus is, especially under self-funded plans, the risk of how much a plan would have to pay if an unvaccinated person gets COVID and has to be hospitalized versus a vaccinated person, that is, meets what is the, I'll defer to you, the undue burden on the employer that therefore maybe a religious accommodation is not required in that context.
We may have to think about an exemption. We may not grant it,
Yep.
but we might have to think about
But
it.
that, and just to be crystal clear, that's a Title VII issue.
Right.
HIPAA is silent on religious accommodations or reasonable alternative standards for religious reasons.
Got it. Okay. Well, this was awesome, Tripp. Thank you so much for being our special guest today on our travel show edition. Will you come back sometime?
Absolutely. Thank you for
Awesome.
having me. It's been great. Can I make a selfless plug here?
You can make it. I'm not sure if we'll show it.
Okay. So for those of you that have enjoyed the benefit episode here, our benefits group does a monthly webinar. It is on the third Wednesday of every month at noon. We call it the Employee Benefits Lunch Break Series. We try to aim for about a half hour, so it's at noon Eastern Time, the third Wednesday of every month. And where I did a lot of them last year, we're going to rotate amongst the benefits group, so you won't have to put up with me every month
Well,
this
thank
year.
goodness for that.
Yes,
I think your
exactly.
viewership just went up.
Thanks, Rebecca.
Thank you.